Hi everyone, we will be discussing about the stomach today. So stomach is also called gaster or belly. So stomach is basically the muscular bag forming the widest and most distensible part of the digestive tube. The upper end connection of the stomach is up with the lower end of esophagus, and the lower end connection of stomach is with duodenum. So the location of stomach is located in epigastric region, umbilical and left hypochondrium. Epigastric, umbilical, left hypochondrium. It is somewhat J-shaped. Stomach is 25 centimeter long, and at birth the capacity of stomach is 30 ml, and at puberty it increases to 1000 ml or 1 liter, and at adult state it is 1.5 to 2 liters. The external features of the stomach. So there are two orifices. The firstly, that is a cardiac orifice on the esophageal end, which is behind the seventh costal cartilage, and the cardiac orifice is 2.5 centimeter from the sternum at T11 level. And the duodenal at the duodenum side there is the pyloric orifice. Orifice is basically the opening. Pyloric orifice is 1.2 centimeter right of the median plane. From the median plane right at the 1.2 centimeter, and it is present at L1 level, also called transpyloric plane. After the two orifices there are two curvatures. This is the lesser curvature and this is the greater curvature. Lesser curvature is concave, as we can see, and it is present on the right side and forms the right border, whereas the greater curvature forms the left border and is convex. And the lesser curvature there is a lesser omentum, and on the greater curvature there is a gastrophrenic ligament, that is from stomach to diaphragm, gastrosplenic ligament, that is from stomach to spleen, and the greater omentum. The notch present here is cardiac notch, and here is angular notch. Also the two surfaces, that is anterior superior surface, that is present on ventral side, that faces forward and upward, whereas the posterior inferior surface faces backward and downward. There are four parts of stomach. So basically fundus, body, pyloric antrum and pyloric canal. There are four parts. Firstly, this is the fundus part. Fundus part is somewhat J-shaped. It from the horizontal line from the cardiac notch, this dome-shaped structure is fundus, and it is mostly distended with the gas. This part is body, that is body is extensions are from line from the angular notch. So this is angular notch, line from the angular notch below to the greater curvature of the stomach. So the greater curvature stomach begins from the here. So greater curvature of stomach, this is body part. Third is pyloric antrum. Pyloric antrum is 7.5 centimeter long and is limited by the faint sulcus intermedius. This is sulcus intermedius, which separates the pyloric antrum from the pyloric canal. This pyloric antrum has pyloric glands present in them, whereas the pyloric canal is 2.5 centimeter long as tubular. So the pyloric glands are seen in pyloric antrum, whereas the gastric glands are seen in the fundus and the body region. So gastric glands are seen in fundus and the body region. There are three types of secretory cells in the gastric glands. First of all, the mucus cells, which secretes the mucus, and mucus protects the gastric lining from the acid action. Second are chief or peptic cells, which secrete the digestive enzyme or pepsinogen, whereas the parietal or axontic cell secretes the HCl. This is about the external features. Now, after the external features, let's see to the relations. First is peritoneal relation, in which peritoneum, lesser and greater omentum, gastrosplenic and gastrophrenic ligaments. Now visceral relations. On the anterior surface, visceral relations on anterior surface, liver, diaphragm and anterior abdominal valve. So we can see here on the anterior surface, this is stomach, diaphragm is present, liver is present, and also anterior abdominal from the upper surface. This is anterior surface, whereas the posterior surface in the visceral relations form the stomach bed. So the very easy trick to remember the stomach bed is Dr. S killed patient mercilessly. Doctor means diaphragm. S stands for spleen. Second S stands for splenic artery. This S stands for splenic flexure of the colon. Killed stand for the kidney, specifically left kidney, and kidney with adrenal gland. Patient stand for the pancreas, and yum stand for the transverse mesocolon. So when we see the diagram of the stomach bed, this is stomach. Firstly, this is diaphragm, that is D. First 3S, that is first S is spleen, second S is splenic artery, third S is a splenic flexure of the colon, which is this splenic flexure of the colon. And then killed, that is K, that is kidney, left kidney with adrenal gland, pancreas, P stand for pancreas, and transverse mesocolon. This area, this blue color area is mesocolon. This is the stomach bed. Now the blood supply of the stomach. So mainly the celiac trunk supplies the stomach. So celiac trunk has three branches. Celiac trunk has three branches, that is left gastric artery, common hepatic artery, and splenic artery. Left gastric, common hepatic, and splenic. So left gastric artery anastomosis with the right gastric artery, and this right gastric artery is branch of the common hepatic artery. That therefore the common hepatic artery has two branches, proper hepatic artery and right gastric artery. This proper hepatic artery supplies the liver. There is no need to learn here, but the right gastric artery anastomosis with the left gastric artery. Now another branch of the common hepatic artery is gastroduodenal artery. This gastroduodenal artery descends down and gives the two branches, that is superior pancreatoduodenal artery and right gastroepipolic artery. This right gastroepipolic artery runs on the greater curvature and anastomosis with the left gastroepipolic artery. This left gastroepipolic artery is branch of splenic artery. So the another branch of the celiac trunk is splenic artery, which gives the small splenic artery on the surface of posterior surface of stomach, and this forms the left gastroepipolic artery, which anastomosis here, and splenic artery gives the branches to spleen as well as the short gastric artery. So this is the blood supply of the stomach. So the quick revision on the blood supply of the stomach. This is the celiac trunk has three branches, left gastric artery, common hepatic artery, and splenic artery. Common hepatic artery has three branches, right gastric artery, gastroduodenal artery, and proper hepatic artery. Right gastric artery and left gastric artery forms the anastomosis. And now the gastroduodenal artery has two branches, superior pancreatoduodenal artery and right gastroepipolic artery. And whereas the splenic artery has two branches, that is short gastric artery and left gastroepipolic artery, and right and left gastroepipolic artery forms the anastomosis. Now the venous drainage. In the venous drainage, we know that portal vein is formed from the splenic vein plus superior mesenteric vein. Splenic vein and superior mesenteric vein forms the portal vein. So right and left gastric veins drain in the portal vein. Left gastroepipolic vein plus short gastric veins drain in the splenic vein, whereas the right gastroepipolic vein drains in the superior mesenteric vein. This is about the venous drainage. Now the lymphatic drainage. So for the lymphatic drainage, we have to make the sections of the heart. So this is a right and this is left section. This is a complete right 2/3, and this is left 1/3 and lower left 2/3. So pancreatocylinic trunk, pancreatocolic node, this left 1/3, upper left 1/3 drains into pancreatocolic node. Lower left 2/3 drains into the right gastroepipolic node, and the pyloric part of the stomach drains into the subpyloric node. So lymph from the right gastroepiphylic node also drains into the subpyloric node, and lymph from subpyloric node drains into hepatic node as well as celiac node. Now the celiac node is the means the terminal node in which all the lymph is drained. So the pancreatoceliac node also drains into the celiac node. Now the right two-third first drains into the left gastric node, which drains into the celiac node, and the hepatic node finally drains into the celiac node. So this is just about the pattern. You have to remember this or practice 1-2 times, you will get it. So for the lymphatic drainage, we have to make the sections of the heart. So this is right and this is left section. This is a complete right 2/3, and this is left 1/3 and lower left 2/3. So pancreatoceliac trunk, pancreatocolic node, this left 1/3, upper left 1/3 drains into pancreatocolic node. Lower left 2/3 drains into the right gastroepiphylic node, and the pyloric part of the stomach drains into the subpyloric node. So lymph from the right gastroepiphylic node also drains into the subpyloric node, and lymph from subpyloric node drains into hepatic node as well as celiac node. Now the celiac node is the the terminal node in which all the lymph is drained. So the pancreatoceliac node also drains into the celiac node. Now the right two-third first drains into the left gastric node, which drains into the celiac node, and the hepatic node finally drains into the celiac node. So this is just about the pattern. We have to. Now comes the nerve supply of the stomach. There is sympathetic nerves and parasympathetic nerves. Sympathetic are T6, T10, T6 to T10, whereas parasympathetic are derived from the vagus. In sympathetic nerves, splenic nerves, celiac and hepatic plexus, whereas in parasympathetic, anterior gastric nerve, which is formed by the left vagal fibers, and posterior gastric nerve, which is formed by the right vagal fibers. So sympathetic is basically vasomotor, that is motor to pyloric sphincters. These are motor to pyloric sphincters. And inhibitory to gastric muscularate, that is the inhibition of gastric muscularate, pathway of pain sensation from stomach. So sympathetic nerves carries the pathway of pain sensation from the stomach, whereas parasympathetic, their stimulation causes the increase in motility of stomach and secretion of gastric juices, which are rich in pepsin and HCl. So parasympathetic, as name indicates, increases the secretion and increases the motility and inhibits the pyloric sphincter. So for now we will see the how anterior gastric nerve is formed by the left vagal fibers. So anterior gastric nerve gives the hepatic branch, then the pyloric branch, and the remaining fibers that forms the anterior nerve of Latarjet. And the posterior gastric nerve, which is formed by the right vagal fibers, gives the celiac branch to the celiac ganglion. One branch, that is celiac branch to celiac ganglion, and remaining, which spreads on the stomach, that is called the posterior nerve of the Latarjet. These both are the parasympathetic nerve supply of the stomach. Now coming to the interior of stomach can be divided into mucosa, submucosa and muscular coat. So mucosa has folds that are called gastric rugae. Longitudinal along the lesser curvature. So this gastric rugae are present longitudinally along the lesser curvature, which forms the gastric canal. Gastric canal is rapid passage for liquid directly into the intestine. We will see this further. So basically this is the lesser curvature, and this is gastric rugae on the lesser curvature side, and this forms the gastric canal. Gastric canal is rapid passage for fluid. So fluid enters here, and rapid passage for fluid from the gastric rugae. So rugae are flattened in distended stomach. In distended stomach they are flattened. Gastric pits have gastric glands. Now the submucosa part, connective tissue, arterioles and nerve plexus come under the submucosa, and in muscular cord there are longitudinal, circular and oblique muscles. Innermost are oblique, middle are circular, and outermost muscles of the stomach are longitudinal. This also be seen in. Coming to the clinical anatomy, the most important is peptic ulcer, and the common site of the peptic ulcer is gastric canal. We will see why. We know this is the gastric canal along the lesser curvature where the gastric rugae are present, and it is the rapid passage for the fluid. So pepsin, gastric canal, pepsin and HCl secreting site. Basically this mainly gastric canal is pepsin and HCl secreting site and receives the insult from the irritating drinks. So meaning of this line means when the irritating drinks like cold drinks or alcohol or any other drinks like carbonated drinks directly passes from this gastric canal, and this is the rapid passage of fluid, so it bears the maximum insult from the irritating fluid. This is also one of the reason for the peptic ulcer. So less nerve supply and abundant blood supply occur in the person who are in hurry, worry and eat spicy curry. So this is gastric pain is felt in epigastrium because the stomach is supplied by T6 to T9. So why the gastric pain is felt in the epigastric region? Because we know the stomach, that is pain sensation of the stomach, is supplied by T6 to T9 by the sympathetic fibers, and this T6 to T9 also supplies the anterior abdominal wall, so the pain is felt in epigastric region. In here, hyposthenic stomach, gastric ulcer, and hypersthenic stomach, duodenal ulcer. So gastric cancer spread via lymphatics, thoracic duct to left supraclavicular node. Enlarged left supraclavicular node is known as Troyer's sign. So basically Troyer's sign is enlarged supraclavicular node because the gastric ulcers is spread via thoracic duct to the left supraclavicular node. So this is all about the stomach.